Okay, joining us on the broadcast this evening, we have two distinguished panelists, Padma Bhushan Dr. Ashok Seth, Chairman of Fortis, Escorts, Heart Institute and Head of Cardiology, Council of Fortis Group of Hospitals. Thank you, Doctor. Good evening.
Thank you.
Thank you for joining us on this. You first, Dr. Seth. What do you make of this emerging situation where, of course, that is, when I say we mean the country and the government taking it very seriously. We are now hearing, and that's the breaking news update this evening, that they're going to review the international travel, which was going to normalize soon. What do you make of the situation first up, and how serious is it?
So clearly, the situation of this new variant is of concern. While the variant has not come into the country, we have to be cautious. While there should be no panic, proactive measures have to be taken. And very stringent proactive measures have to be taken, going by our past experience of the Delta virus. We know that this virus has more mutations than the Delta virus, and that is the real cause of concern. And that is why it did not even get into the category of variant of interest. It straight away moved to the category of a variant of concern. I'm actually very happy that very specific and stringent measures have been taken by our policymakers, by the government, by our experts, and by our states in a close coordination. At least we need to know what happens over the next few days. And by the way, it's an evolving situation. So what stands today would be, we would be more knowledgeable tomorrow and the day after. In the subsequent couple of weeks, we will be more knowledgeable to understand whether we need to be hitting this hard, but preparations have to be in place. Scrutiny has to be in place, surveillance and genomic sequences have to be ramped up, and clearly whatever measures have been taken for the travelers to have RT-PCR and genome sequencing are utmost important. Clusters have to be preparations for any such spurt, a wave has to be revised, recognized, and at least be ready for what may or may not come. And let's not be panicked about it that we're going to see such a huge wave coming. There's absolutely no panic. The issue is, it's better to be proactive and prepared rather than repent later on just because we delayed our preparations.
What is your view on the travel restrictions? Because some countries have taken some drastic measures. For example, Israel has completely shut its doors to any foreigners traveling into the country. Many countries taking steps to ensure that the high-risk nations, nobody is allowed inside. What's your view? What's the medical view on a situation like this?
So it's an evolving situation, and every country tries to understand the circumstances as it suits best at that period of time. There's no question that we've called these countries at risk and are clearly having good surveillance and scrutiny on every passenger coming from Africa. We must also remember that Europe is in the middle of huge surges of COVID from the Delta virus already. And we all recognize the fact that their hospitals are getting flooded. The last thing they would want is another virus coming in and therefore really creating a situation. By the way, it's still this virus, just like Dr. Soin mentioned, it's a potential issue with this virus. It's not proven whether it's going to be more infective, whether it's going to cause serious issues, whether it's going to bypass immunity. These are all potential issues. But I'm sure that these steps are taken, and I would say that for a moment, our country has taken appropriate stuff of great scrutiny. It's an evolving situation. It is possible that in 3 days, we may actually say, let's just stop passengers, but the government is doing its job very efficiently at this moment. And I would actually say to everybody that with the Prime Minister who's taken a stock of the situation at the helm of the affairs, I think we should feel safe with every policy that's being instituted by the government in this issue.
Yeah, correct. I agree with you on that.
I'm happy to address that. And let me just say that your first and biggest defense to any spread is your COVID appropriate behavior, which is very important even for for children who are, say, 10 to 16 years of age. Masking is an important aspect, and most schools have actually maintained situations which are actually appropriate to the COVID circumstances. Education has to happen in schools, by the way. Unfortunately, the children have been too long a time away from schools, which has hampered the education. It cannot continue on and on. That's the first point. The second point is, yes, the elder children can actually follow COVID appropriate behavior, which still remains our most biggest, clearly the strongest defense that we have. And finally, we have to understand that yes, government is considering this very issue about vaccination in children. You read this every day. The issue really is for you all to understand is that in children, and that has been seen till now and even in the West, the disease process is usually not very severe, at least with the previous strains on the virus. And then in children, we've got to weigh the risk of vaccination very closely versus the risk of delaying vaccination till adults are vaccinated. Now that balance is the fine balance which the government and the experts are looking at. And I'm sure that in the next couple of weeks, the experts will actually talk about it. It will come into position. Till that time, I think just follow the COVID appropriate behavior, go to school and not worry. By the way, Omicron is not here at the moment. There are no concerns, and there's a huge scrutiny on every testing which has happened. So we should not be worrying. As far as we know, there's no Omicron entered into the system. And we don't know whether it causes serious illnesses or whether it's more virulent. Those are speculations based on the way it has mutated. That's all we can say at the moment.